moving calves physically, and as far as my health, I thought I was feeling fine other than maybe shortness of breath every now and then.
Raising cattle has run in the Muck family for generations, but that's not the only thing.
My dad had a heart attack and bypass in his mid-50s. So with the history of my family and, at my age too, I'm getting upper 60s. I thought, maybe now's the time.
Being the older brother, David was the first to schedule a Planet Heart screen, and his results quickly justified the visit.
You could just see on her face that, because I told my wife before I found out, I said, I don't have a good feeling about this. And then they told me what the results were, and real high calcium levels.
Planet Heart is helpful because it really helps us define risk, right? It's not going to tell us necessarily how bad of a blockage do you have and where is it. It helps us know what is your risk over the next 10 years of having, a heart attack or a stroke and things like that, and what can we do to prevent that.
David's calcium score pointed to further testing, so an angiogram was ordered to check for a possible blockage.
If you do have a problem and we can fix it and we can do a stent, we will do that right away. Well, as quick as that seemed that went, I thought, this probably didn't go good. And then my wife told me, she said, he said, you're going to need triple bypass.
When they find disease in all three of the main arteries, stenting's certainly an option, medical treatment's an option, but if you have disease in all three of your arteries, then bypass surgery is certainly a good option. And so we ended up doing a triple bypass on him.
Catching the problem before an emergency means a less challenging road to recovery. And David was giving Brian the Planet Heart pitch before he even left the hospital.
I told him, I said, you need to get checked. And he did.
I eventually got checked out, and I went to Planet Heart.
Found out he had a higher calcium score than I had.
So when they saw that, then they started doing more testing. Kind of stunned that was going to be triple bypass, so.
These guys are like the nurse said, they were the two healthiest guys we have in TRIP, and they both had bypass surgery. So genetics plays a big part of it.
If your father or mother have had it, you may have it too. So absolutely you need to get checked out about it.
After having the same surgery 5 months apart, David and Brian are on the mend and hope their example shows just how sneaky heart disease can be. They're lucky they're both back doing what they love. And for David, he has a little extra leverage against his younger brother, what with helping saving his life and all.
I am going to definitely hold that one on him, because he really, I think he questioned whether he should do it, but I pushed pretty hard.
Living life, doing what I had been doing. I don't want to change, raising cattle and seeing the grandkids and all that. That's what life's all about.